Hi everyone, my name is Denise Coughlin. I'm the owner of Resolute Studios based in both Mullingar and in County Dublin. Today I just want to explain to you about a class that I'm running in the Dublin studio, which is the Resolute Heart Programme. This is a Phase 4 cardiac rehabilitation exercise programme for heart patients directly referred from either hospitals based around the Dublin area or from your local GP. I'm a Phase 4 exercise instructor qualified through the BACPR or British Cardiac Rehabilitation Association. So this means I am qualified to take heart patients directly, as I said, from the hospitals or from the local GPs. So just to explain to you about the different phases of cardiac rehabilitation that you go through. First of all, the first phase, phase 1, is when you'll get your diagnosis through either the hospital or your GP, and you may or may not have to get your treatment done straight away. So it could be angina, it could be a heart attack, it could be to go in for something a little bit more serious like bypass surgery. So this would be your first phase, which is diagnosis and or treatment. From here, after you've had your treatment and diagnosis, you will go on to phase 2. Phase 2 then, you're most likely to be referred back to your local GP by your hospital, or you will continue on treatment within the hospital. You might get some advice on your healthy eating, nutrition, counselling off your GP, and then from there, if the GP and the hospital see fit, they may refer you on to a phase 3 program. Phase 3 is usually based within the hospital again, although there is some outside community programs, but most of the time it's based within the hospital. So phase 3 is a full program. You'll get your exercise program, which is usually a gym-based program within the hospital. They will give you access to occupational and psychological counselling. They will give you nutritional advice, back to work advice, relationship advice post cardiac event. So it's a full phase of mind-body rehabilitation within the hospital. Generally what happens after phase 3, people are discharged and they are just recommended to continue on the programs or healthy eating, exercise themselves. So what I've found through my own research is the phase 4 exercise program, which I'm now qualified since 2008 to be able to teach you guys. So this is a phase 4 program. The phase 4 program, the patients are directly referred, as I've said earlier on, to myself, where I will continue on your exercise program. I will receive a referral form which allows me to see full medical information about each client that comes into the studio. So it'll tell me what medication you're on, what type of exercise program you've completed within the hospital, any other past medical history, and so on. And from here then I'll be able to prescribe you an exercise program either to complete at home or to complete within the studio. So the studio-based classes, they can be 2 types of exercise classes. You can have a gym-based class, which is using stationary equipment, the likes of a bike, cross trainer, rowing machine, and it will be only a small group, about 6 people per class. You'll also have a circuit style class, which is small pieces of equipment, the likes of the steps, hand weight, stability ball, and so on, and it will be set up in a circuit type class for you to continue then. So these are the types of classes that you'll have within the studio. I'm going to go through a few of the risk factors that may cause you to develop cardiac disease, and also the benefits of the cardiac rehabilitation that you can complete within the studio here in Resolute. So let's go through a few of them now.
Risk factors for developing heart disease. There are 2 types of risk factors: non-modifiable and modifiable risk factors. Non-modifiable risk factors include age. Coronary heart disease increases steadily with age as the coronary arteries progressively degenerate. It rarely occurs before the age of 30. Gender. Men develop coronary heart disease at a younger age than women, as women appear to be protected by estrogen, but by the age of 60, instances in women accelerates. A combination of age and other risk factors such as high blood pressure and high cholesterol increases the chances of developing coronary heart disease. Family history. Coronary heart disease can run in families. The risk of it developing can increase by 30% if one parent developed coronary heart disease before the age of 55, and increases by 50% if both parents had early coronary heart disease. Ethnic origin. Studies have shown that South Asian communities have shown a higher instance of coronary heart disease and a lower than average instance in Afro-Caribbean origin, due to the differences in diets and physical activities. Modifiable risk factors. These are risk factors that we can help to change ourselves in order to help prevent coronary heart disease from developing. Smoking. The risk of developing coronary heart disease in smokers is 2 to 3 times that of a non-smoker. When a person stops smoking, the risk of developing coronary heart disease reduces. Passive smoking also increases the risk of coronary heart disease. By stopping smoking, you can dramatically reduce the risk of further events occurring. Hyperlipidemia, high cholesterol. Low-density lipoproteins, LDLs, are known as bad cholesterol. LDLs can begin to stick to your arteries and over time form fatty deposits called plaques, which decreases the opening in the arteries, constricting the blood flow to the heart. HDLs, or high-density lipoproteins, are the good cholesterol. HDLs are considered beneficial for cardiovascular health. Hypertension, high blood pressure. Often people with high blood pressure have no symptoms. High blood pressure occurs when the blood vessels narrow and tighten. Your heart, in turn, has to work harder against the increases in pressure. If the heart does not receive enough oxygen, angina may occur. Lifestyle changes and medication can help control high blood pressure. Inactivity. The heart needs exercise to keep fit. Lack of exercise is a major factor for increasing the chances of developing coronary heart disease. Regular exercise can help reduce some of the other risk factors, such as high blood pressure, obesity, etc. Obesity. BMI, or body mass index, is a scale of measuring weight and height, defining a person as overweight or obese. People who have large waist circumferences have a higher risk of developing coronary heart disease. Type 2 diabetes. Insulin, a hormone produced by the pancreas, helps the body's cells either store or use glucose. People with diabetes either don't make enough insulin or their cells are unable to use insulin effectively. This causes sugar levels to rise in the blood, a condition called hyperglycemia. High sugar levels over time can damage the body's organs. When combined, high sugar and high fat makes diabetes a major risk factor for angina and coronary artery disease. Fibrinogen levels. Fibrin is a fibrous protein involved in the clotting of blood. It is a fibrillar protein that forms a mesh that forms a plug or a clot over a wound site. Excess alcohol. Alcohol use has many of its own risk factors like increasing blood pressure, body weight, heart failure, addiction and accidents. People who limit their use of alcohol also have a lower risk of developing colon cancer, breast cancer and stroke. Psychosocial factors. Stress may contribute to development of CHD or coronary heart disease. Stress can trigger your arteries to narrow. This can raise your blood pressure and your risk of having a heart attack. A commonly reported trigger of heart attack is an emotionally upsetting event, especially one involving anger. Stress can also indirectly raise your risk of CHD if it makes you more likely to smoke, overeat foods such as high fat and high sugar. Benefits of Phase 4 cardiac rehabilitation exercise classes. Some of the benefits may include reduced hospital admission, reduced angina, improved lipid profiles or cholesterol, improved blood pressure, improved functional capacity or function of the heart, improved lifestyle modifications, reduced anxiety and depression, increased confidence and well-being, improved return to work and leisure activities, improved health and education of family and friends. The benefit of Phase 4 classes is that the patients are referred by GPs or hospitals to qualified instructors in Phase 4 exercise rehabilitation, who have received the specialist training to deal with people with coronary heart disease. This means that the instructor has the training and expertise to organise a group or a personalised training session using the information received from the referral form with each patient's medication, heart rates and other medical details.
So I hope this gives you a little bit of a better understanding about what's involved in cardiac rehabilitation, or more specifically Phase 4 cardiac rehabilitation. If you want to start these classes, first of all you will need to contact your local GP, or if you are still in contact with your hospital, you will need to contact the hospital to ask them about Phase 4 classes. You will also need to get a referral form either off your GP or your hospital, which they can send out then to myself. If they don't know of my classes, or if you need any information about my classes to give to the hospital, please contact me and I can send these on for your hospital or your GP. If you'd like to see any other information about the classes or my contact details, you can go onto the website, which is www.resolute.ie, where you can find all the classes, timetable and everything else that goes on in the studio.